day after my surgery. I've just been for my consultation and everything's as it should be. I asked about the bruising, whether it was normal, and they said it's fine. It does tend to happen. Yeah, it doesn't look attractive though. It looks pretty scary. I'm really happy because they've told me that I've got better than 2020. So yeah, I'm really happy about that. Everything's just so clear. I'm going to go into some more detail about the whole procedure yesterday and what they've given me. I was asked beforehand if I wanted to hold someone's hand, like get a nurse in to hold someone's hand, but I thought I'm alright. I didn't really want to hold someone's hand that I didn't know. It would be a bit strange. So they gave me a stress ball. Didn't really help. The hand might have been better. I was asked to lie down on this chair and then they put the drops in so that I couldn't feel anything. Anaesthetic drops. I was put under the Itralase machine and I had to look into a sort of tunnel of lights. Then they had to put the suction machine on. So they did this eye first. I put the suction machine on fine, couldn't feel it at all. When they put the suction thing on, I couldn't see anything, it just went black in that eye. I could still see out of that eye, but I had a thing over my eye. And then I could hear the woman's voice counting down how much longer it would take. So it was like, it didn't take that long at all. He went on to this eye and he tried to put the suction machine on and I could feel it that time. I could like feel, it felt really uncomfortable and it hurt a bit. And then the suction machine wouldn't suck, it like came off and I was like, oh, that eye really hurts, that eye really hurts. The other eye didn't and this one does. And he was like, oh, it's just because you're trying to close your eye. And I was like, no, it genuinely does hurt. So he put some more anaesthetic drops in and then he tried to put the suction machine on it again and it came off again. And that happened another 2 times and then it worked. So that's why this eye is a lot more bruised than this one, because this one had a lot more difficulty with. But once that was done, everything was a little bit blurry and then they swiveled the chair, like bed chair thing, to the Wavefront machine. Then it was the next bit that I really didn't like, it was eye clamps. Go around your eyelids and they like, I don't know if they tighten them or something to make your eyes like go wider. That was pretty unpleasant. I could see when the surgeon lifted the flap and then he like dabbed underneath, like he dabbed the surface with a little sponge and then it was onto the laser to correct the eye. All I had to do was look into this orange light and then it was like a clicking, zapping sound going on. It kind of smelled like, if I don't know if any of you have ever straightened your hair and perhaps held the straightener on too long and it makes a burny smell. It was quite similar to that. And after the laser had been done, I saw him put the flap back and then squirt some like drops in, probably antibacterial drops or something, antibiotic, I don't know, something like that, and then flatten it down with sponges, which was kind of weird because I couldn't feel any of that, but I could feel it when the sponge touched the corner of my eye. I could feel it. It was really strange because I couldn't actually feel anything on my eye. When I left the room, I was obviously really shaken up. I could see about the same as before it was done, but it was a bit cloudy. And then I was taken into another room where the surgeon checked that it was all okay. And Mum and Elliot had to guide me back to the train station. The whole time I had my eyes shut because it was windy and obviously people were smoking in the city centre and it was raining as well, just to help things. So there was wind, rain, fag smoke blowing in my eyes, so I just had my eyes shut with them, with Mum and Elliot guiding me back to the train station. Not fun. Or really, at that point, all you want to do is get home. Obviously I had to endure the train journey. The whole time I had my eyes shut, my sunglasses on and my hands over my eyes, and it was still too bright. It was just ridiculous. It was like, you know, at night when everything's pitch black and you switch the light on and you're like, ah, you can't open your eyes, and it's like that. So anyway, I got home, shoved my pyjamas on and the goggles and just went straight to bed for about, I probably had about an hour's sleep. And then Elliot came back to see how I was getting on, and he made me some dinner because he was lovely. And I just spent the rest of the night just chilling out with Elliot, and then I went to bed. I did have a bit of difficulty sleeping. It was like, I don't know if my eyes were slightly puffy or something, but it was like they ached a bit. And it was actually more comfortable to have my eyes open than closed for some reason. I had to put the drops in. I'll show you these drops. They gave me a little bag with a piece of paper that says when you've got to take the drops and how often and whatever. And then I've got different kinds of drops. These ones are just like tear drops. They're just like fake tears, really. They just keep your eyes moist. Then there's another one. That one is like there's two. I'm not really sure what the difference is, but one is cloudy and one isn't. But I'm not really sure what the difference is, other than one's a bigger bottle and you take it more often. But these are both to heal your eyes. And they're probably like antibacterial sort of things. So I have to use that one 6 times a day and that one 4 times a day. Last night I used these and they absolutely wrecked. It felt like, it's weird because when your eyes shut it doesn't hurt, but when you open them it's like someone is stabbing needles in your eyes. I don't know if I'm just over exaggerating, but it really stings. But after about 10 seconds it goes, it's fine. I'm going to have to put these in a minute. I'm not looking forward to that because it stings. It does sting a bit less today, probably because it's healed or healing. The only thing that I'm not happy about is the extent of the bruising, because it looks horrific and it's going to take a good few weeks to heal. I wouldn't recommend going back to work after like 3 days because, well, I mean, you'd have to take all these drops with you, and the cloudy ones, they just look terrible after about an hour of having them in because you have like white gunk all in your eyes. And obviously the bruising, which everyone gets apparently, maybe not to this extent, but everyone gets the bruising. Because you can't wear makeup, it'd probably be alright for guys, but, well, most guys. It's just, you can't really get back to your normal life for at least a week. But I've got another checkup next Friday, so I'll let you know how that goes then. I think I'll just give it a week to see if there's any improvements, but I'm really happy. Got better than 2020, which is better than what I would have had with glasses. I'll see if I can show you what I can see now out the window. This is what I can see now, and it's all so clear. And my rabbit's at the end of the garden in her hutch, and I can see her. I can see every bit of detail. I can see that she's washing herself right now. If I perhaps put it on macro, I mean, this is pretty much what I saw before. I mean, it's gone clearer. It's like blurry. I couldn't see individual leaves on trees. I could most definitely not see my rabbit, and it's just absolutely amazing. I'm just so happy. I've got to say, so happy. So overall, very pleased with everything. Oh, my phone's ringing. Hang on a minute. Hello? Sorry, that was just Mum. Anyway, I've got to put these horrible drops in, but it's got to be done. I've got to put these in now, so I'd best be off. And I will be making my next video same time next week. So, see you then. Bye!